Good morning. This is Dr. Alduri again. Today presentation will be about sexually transmitted diseases. The scope of this problem is a serious one. Sexually transmitted infection have serious consequences beyond the immediate impact of the infection itself. STI like herpes, gonorrhea, syphilis can increase the risk of HIV acquisition. Mother-to-child transmission of STIs can result in stillbirth, neonatal death, low birth weight, prematurity, sepsis, neonatal conjunctivitis, congenital deformity. HIV infection causes cervical and other types of cancer. Hepatitis B resulted in estimated 820,000 deaths in 2019, mostly from cirrhosis and hepatocellular carcinoma. STIs such as gonorrhea, chlamydia are major causes for pelvic inflammatory disease and infertility in women. More than 1 million sexually transmitted infections are acquired every day worldwide, with the majority of which are asymptomatic. Each year, there are estimated 374 million new infections with 1 to 4 curable STIs: chlamydia, gonorrhea, syphilis, and trichomonosis. More than 500 million people between the age of 15 to 49 are estimated to have the genital infection with herpes simplex type 1 or type 2. Human papillomavirus infection is associated with 311,000 cervical cancer deaths a year. Almost 1 million pregnant women were estimated to be infected with syphilis in 2016, resulting in over 350,000 adverse birth outcomes. STIs have direct impact on sexual and reproductive health through stigmatization, infertility, cancer, pregnancy complication, and can increase the risk of HIV. Drug resistance is the major threat to reducing the burden of STI worldwide. More than 30 different bacteria, viruses, parasites are known to be transmitted through sexual contact, including vaginal, anal, and oral sex. Some STIs are also transmitted from mother to child during pregnancy, childbirth, and breastfeeding. 8 pathogens are linked to the greatest incidence of STIs. Of these, 4 are currently curable, as syphilis, gonorrhea, chlamydia, trichomonosis. There are other 4 incurable virus infections, which is hepatitis B, herpes simplex type 1, type 2, and HPV, human papillomavirus. In addition, emerging outbreak of new infection that can be acquired by sexual contact, such as monkey pox, Shigella sonnei, Neisseria meningitidis, Ebola, and Zika, as well as re-emergence of neglected STIs such as lymphogranuloma venereum. These herald increasing challenges in the provision of adequate services of STIs prevention and control. Genital warts, human papillomavirus. You do not have to have sex to get STD. Direct skin-to-skin contact is enough to spread the HPV, the virus family that causes genital wart. Some types causes wart are usually harmless, but others may lead to cervical or anal cancer. Vaccine to protect against some of these dangerous types are present. The signs is pink or flesh-colored wart that are raised or flat or shaped like a cauliflower. Often it is asymptomatic. The second one will be crab lice, which is set up in the pubic hair. The term comes from the shape of the tiny parasite, which look very different from the head or body lice. The creature crawls from one person to another during close contact. Pubic lice can be killed with over-the-counter lotion. Symptoms are intense itching, tiny eggs attached to the pubic hair, or crawling lice. Scabies is an itchy infestation caused by tiny mites that burrows into human skin to lay eggs. It is not always an STD, as it can spread through any skin-to-skin contact. But among young adults, the mites are often acquired during sex. Scabies is treated with a prescription cream. Symptoms are intense itching, especially at night, and pimple-like rash. It may take 2 to 6 weeks for symptoms to appear. Gonorrhea. This is called the clap. Gonorrhea spread easily and can lead to infertility in both men and women if untreated. Antibiotic stops the infection. Symptoms. The common symptoms are burning during urination and discharge, but often there are no early symptoms. Later, the infection may cause a skin rash or spread to the blood, to the joint and blood. In men, the discharge comes from the penis. There will be swollen testicles. In women, vaginal discharge, pelvic pain, spotting. Sometimes may be mild and are easily confused with urinary tract or vaginal infection. Herpes simplex type 2. Most cases of genital herpes are caused by type 2 herpes simplex virus. It is highly contagious and can spread through intercourse or direct contact to the herpes sore. Herpes type 1, there is no cure, but antiviral drug may make outbreak less frequent and help clear up symptoms more quickly. The symptoms are fluid-filled blisters that form painful crusted sores on the genital, anus, thighs, and buttock, and can also spread through the lips through oral contact. Syphilis. Most people do not notice early symptoms of syphilis. The USPSTF recommends screening for syphilis infection in persons who are at increased risk of infection. Without treatment, it can lead to paralysis, blindness, and death. Syphilis can be cured with antibiotic. Signs and symptoms. The first sign is usually firm, round, painless sore on the genital or anus. The disease spread through direct contact with the sore. Later, there may be a rash on the sole and the palm or other part of the body, as well as a swollen gland, fever, hair loss, fatigue. In late stages, symptoms come from damage to organs such as heart, brain, liver, nerves, and eyes. Chlamydia. It is a common sexually transmitted disease that can lead to infertility if left untreated. It clears up quickly with antibiotic, but it often goes unnoticed because symptoms are vague or absent. Chlamydia can also infect the rectum and the throat. In men, the symptoms are burning or itching at the tip of the penis, discharge, painful urination. In women, the symptoms are vaginal itching, discharge that may have an odor, pain during sex, and painful urination. Herpes simplex type 1, the painful cold sore you get on your lip every now and then. It is probably caused by type 1 herpes simplex virus. This virus is usually not sexually transmitted. It spread easily among household members through kissing, but it can be spread to the genital through oral or genital contact with an infected person. Though there is no cure, the drug can shorten or prevent outbreaks. Signs and symptoms. It is a painful cold sore or fever blister on the lip. Small blisters or sore on the genitals are also possible. Hepatitis B is a stealthy virus and can cause liver damage. It spreads through contact with the blood or any other bloody fluid. People can be infected through sex, needle sharing at birth, as well as by sharing razors, toothbrush. There is no cure, but drugs can keep the virus in check. There will also be an effective vaccine to prevent hepatitis B. The symptoms: people may develop nausea, belly pain, dark urine, fatigue, yellowing of the skin or the eyes with acute infection. Chronic infection can lead to liver cirrhosis and liver cancer. Many people have no symptoms for years. HIV. The virus HIV weakens the body defense against infection. HIV spread through unprotected sex, sharing needle, being born to an infected mother. It may cause no symptoms for years, so the blood test is the best way to learn about the status. Timely treatment is important to prevent serious illnesses. Early symptoms of HIV: it has no symptoms. Most people get temporary flu-like illness for 1 to 2 months after the infection. Swollen gland, fever, headache, and fatigue. Canker sores in the mouth can also occur too. HIV/AIDS test. The reliable HIV test can be done in clinic or at home with FDA-approved home access brand test kit. Anonymous tests use only a number to identify you. One limitation is the window period, about 6 months after exposure to HIV, when these antibodies tests sometimes do not find the virus. You can pass HIV to others during that time. If you suspect HIV, if you've been exposed to HIV, start medication immediately that can help prevent the infection. If you have the virus, treatment can also prevent HIV from turning to AIDS. Treatment option: while there is no cure for HIV, there are medications that can suppress the amount of the virus multiplying inside the body. People can take combination of antiviral drug in the hopes of preventing the infection from advancing to AIDS. Additional treatment can help prevent or fight off serious infection if the immune system has weakened. While there is no cure for HIV, there are medications that suppress the amount of virus multiplying in the body. People take combination of antiviral drug to prevent the infection from advancing to AIDS. Additional treatment can help to prevent or fight serious infection if the immune system has weakened. Trichomoniasis. Trichomonas is caused by a parasite that spread through sexual contact. It can be cured with a prescription drug. Signs and symptoms in men: most men have no obvious symptoms. Some develop mild discharge or slight burning during urination. Sign and symptom in women: women may develop yellow-green discharge with a strong odor, vaginal itching, painful sex, or urination. Symptoms usually begin 5 to 28 days after acquiring the parasite. Chancroid. This is a bacterial sexually transmitted disease common in Africa and Asia and rare in US. It causes genital sore that can spread the bacteria from one person to the other. Antibiotic can cure the infection. Symptoms in men: it's a painful bump on the penis that may develop into pus-filled open sore, pain in the genital and groin. Symptoms in women: painful bump in the genital area that can develop into open swollen lymph node in the groin. Lymphogranuloma venereum is a type of chlamydia that is usually rare in US, but is becoming more common in men who have sex with men. Like other forms of chlamydia, it can be cured with antibiotic. Symptoms is like open sore on the genital or anus, headache, fever, fatigue, swollen lymph gland in the groin. If acquired through sex, lymphogranuloma venereum can cause rectal bleeding or discharge. Pelvic inflammatory disease, not itself STD, but it is a serious complication of untreated STD, especially chlamydia and gonorrhea. It happens when bacteria spread to the infection of the uterus and other female reproductive tract. Prompt treatment is essential to prevent damage to women's fertility. Presentation is lower abdominal pain, fever, unusual discharge, painful intercourse, painful urination, and spotting. However, there are no warning signs. To prevent sexually transmitted disease is to abstain from any sexual contact and be in a monogamous long-term relationship with uninfected partner to reduce the odds of getting the infection. Ask your partner if they had STD. Ask the partner to be tested before any sexual activity. Use condom if you can. Avoid sexual activity if the partner has signs of STD. Be aware of symptoms and get regular checkup with your healthcare provider. Now, while condoms are effective in preventing the spread of STD, they are not perfect. Condoms are better at protecting against gonorrhea, chlamydia, HIV, trichomoniasis, but they offer less protection against herpes, syphilis, genital wart. This infection can spread through contact with the skin lesions that are not covered by condom. Finally, the condom offers no protection against crab and scabies. For the treatment option, please consult your provider. This informational presentation was the purpose for information only, not for diagnosis and treatment, but to bring the awareness to the topic.